Today I'm going to talk about the importance of a natural birth, what choices we have as parents, and what choices we have as people. Most doctors, OBs, and physicians that we see during our pregnancy do not give us options. They just assume that we are going to follow the cookie cutter standard of how we give birth and what choices we're going to make as parents. I'm looking at my PowerPoint right now, and I've submitted that with the speech so that you can follow along with it as well. The best place to start is, why go natural? We start into this world as humans, and the best way to explain it is that we need the most natural start. We need to have that natural beginning and need to have that beginning as clean and as pure as possible to give us the best chance at life. Childbirth is what women's bodies was made to do, along with other things. We produce milk for our children to feed them, and we also are made to give birth. That's what our bodies do. The interventions interfere with that natural process. If you have an epidural, it will block your oxytocins, your natural endorphins, and your body won't heal as naturally or as quickly as it would had you not had that epidural. Also, having the ability to get up and move around and be able to move and position yourself in a place where you are able to give birth naturally and to feel and help with that baby coming into the world is also the best thing. The baby's not aware the first few days if you have an epidural. What this does, not only blocking the endorphins and the natural hormones that release into your body to help with your recovery and to help with the natural pain blockers, the baby becomes lethargic. It blocks off different things that the baby would normally feel or would normally do. There's an unmedicated child video on YouTube. It's called the birth crawl or the breast crawl. And what it is it's a newborn baby, and she or he, doesn't show the sex, is born and within a few hours placed upon the mother's belly. And this baby crawls from the mother's belly into the position to naturally breastfeed. The mom does not help. She just lays there and assists a little bit with moving the breasts to the baby's mouth, but she's laying on her back or slightly propped up so this baby can get to her breasts. It's pretty immaculate to watch. I've included some pictures. You can see that the baby on the left is an unmedicated baby and has had no interventions during the pregnancy. The mom is actually in a tub and gave birth to this baby naturally in water. The baby is slightly clean because she came from water, but you can notice that the baby's staring into her mother's eyes and is able to see and is able to comprehend and is able to have that natural start. Most babies that come into the world unmedicated and without intervention have a better sight distance from their baby's natural sight is about 12 to 15 inches. It's about that much. And what it is it's from holding a baby in your arms, feeding at your breast to your face. And so to block that with the eye goo that they put on babies, which is on the baby on the right, the baby has to close its eyes. It's almost, unfortunately, looks like the baby's not even alive because the baby's eyes are closed and it's medicated and almost in a trance-like state. We move on to the bond that it creates. There's a bond that mother and baby and father all have once you have this endorphin. It's almost like a natural high, if you will. Mother and baby are able to have that natural endorphin release and that oxytocin, which is like a natural high. You are able to bond with your baby a lot more, and dad, I believe, feels that as well. It's kind of the energy that's in the room. There is research that links epidurals to C-sections. A lot of women that end up having epidurals don't end up having the natural vaginal birth that we are made to do. They also have to include forceps or vacuum extraction, and their labors are generally longer. Epidurals are more likely to cause fevering in the baby and the woman, and because of that, they will generally whisk the baby, whisk the baby away, and treat the baby for infection. So not only are you causing these interventions, but it's kind of like a snowball effect. You start with an epidural, the epidural leads to a longer labor, the longer labor leads to a fever, and the fever initially leads to taking the baby away from the mom right away. And the best thing for that baby is to have skin to skin with the mother immediately and to breastfeed as soon as possible. Evidence shows that epidurals also cause more cesarean births and an increase, especially in first-time mothers. The best thing for babies is to keep them with their mother, and so once there is a fever or any kind of infection that they fear, that it's best to keep mom with baby, even if that were the case. Skin to skin it's called kangaroo care, and what it is when you put a mom and baby skin to skin or a dad and baby skin to skin, it helps regulate their temperature, it helps with their blood flow and everything. And the reason it's called kangaroo care is because when kangaroos have their babies and they're in their pouch, they're close to their mother, and it helps to regulate everything as far as putting that baby in a homeostatic state where everything is just leveled out and everything is just perfect, actually. So when you keep mom and baby together, mom and baby both produce a level of natural hormones, and it's regulated when they're connected and skin to skin, chest to chest. The catecholamines assure that the baby is alert as well as mom is alert. The oxytocin helps prevent excessive bleeding when mom is delivering her placenta and the rest of the delivery. The endorphins help to keep both mom and baby calm and responsive. This also helps with breastfeeding. We produce our own food, and the benefits of breastfeeding are amazing. It enhances the baby's immune system. It protects against chronic disease, type 1 diabetes, childhood cancer, obesity, Crohn's, and asthma, as well as it helps mature the brainstem. So that they notice in a lot of studies that they've done on babies that are breastfed as opposed to babies that are not, their alertness and their brainstem maturation tends to produce a lot quicker. I don't want to say are smarter, but in a sense they are, because their brainstem is maturing a lot quicker. And the cost of breastfeeding is little to nothing. You're feeding yourself, therefore you're producing food for your baby, therefore you're feeding your baby. I've included a diagram of the proper latch and how to latch a baby on properly. And then I've added on to the end of this placental encapsulation. It's kind of working full circle. You get pregnant, you have your baby, you produce this placenta that helps to feed your baby and nourish your baby throughout pregnancy, and then at the end we just kind of discard it. And what it is it has a bunch of hormones, and it's one of the only organs that we are able to get rid of once we are done with it. And by getting rid of it and just throwing it away or doing whatever you will with it, it kind of takes away from what it is and what it's good for. It has a lot of hormones, it has a lot of richness and iron and different things that are in it that help with leveling the hormone imbalance once the baby is born. You go from having a baby and having those hormones inside of you to the next minute having them drop. You have those endorphins and that natural hormones that are released once the baby is born, but when the baby is a few days old, your hormone level starts to drop. And so by encapsulating your placenta, whether it's in gel caps or if you put it into a lasagna or make some kind of cocktail out of it, those are a little more extreme, but the encapsulation, you dry it and you put it into pills and you take a couple a day until it's gone, and that kind of helps to level out your hormones and to prevent baby blues or postpartum depression. A lot of people also use the placenta membrane to make keepsakes like a wallet or a purse, or I've included a picture of the teddy bear. There's a lot of healing properties that go along with this too. It helps with your lactation if you're having a hard time producing milk. taking these pills can help increase that lactation and feed your baby even more. So it's kind of working full circle. If you give birth and then you save the placenta, dehydrate it, encapsulate it, and then take that through ingestion again, it ends up being a full circle thing. I've included reasons to do it just really quick. It helps with postpartum and baby blues. It helps increase the breast milk, like I said. Your energy increases, and then your decrease in lochia and also bleeding, which is hemorrhaging. Lochia is hemorrhaging, and then iron deficiency, insomnia and sleep disorders, and night sweats. Those are a lot of the things that it helps prevent and increase. In conclusion to all the information I've already provided, natural start is the best way to go. I know that sometimes there are things that prevent that, and I advocate for anyone that is trying to have a natural birth. Just know your options. Just know that when you go into a hospital, that you don't have to do exactly what they say, that you don't have to do everything by the book for the protocol, and be your baby's advocate as well for yourself. Go into this pregnancy and this birth knowing everything. Have a plan. Present that to your provider, whether it's a midwife or an OB, and prepare. When you run a marathon, you don't wake up one day and run 26.2 miles. You prepare yourself. You condition yourself. You get ready for that marathon. It's the same with birth. Birth is not easy. It's not a walk in the park. It's something that our bodies are meant to do, but we need to prepare for that because it's not something we do every day. So knowing what to do to prepare, whether it's yoga or exercise or chiropractic care or stretching or educating your brain, just work every aspect that you can and know that you have options, and enjoy your new family with your new baby. Thank you.